Good evening everyone. Welcome back to a brand new episode of BMC Global Live Al-HILAL Health World, Nothing But Lifestyle. I'm Anupama Menon. Good health is not valued until sickness comes. In this talk show Health World, we have expert doctors from various fields providing valuable information to you on different medical topics so that you can keep diseases at bay and enjoy good health. Today, we are delighted to have with us Dr. Roopchand PS, Specialist Neurologist at Al-HILAL Hospital, Moharrak. He comes with an experience of 8 years in the field of neurology and he is an expert in dealing with movement disorders, epilepsy and headache syndromes. So today, our topic of discussion is epilepsy. Let's know more about this from Dr. Roopchand. We'll go over to him now. Hello doctor, how are you doing today?
Fine, I'm fine today.
Welcome to the show.
Thank you.
Doctor, before we begin, could you please differentiate epilepsy and seizure, because a lot of us get confused with this. You know, we often talk of epilepsy as seizures. So is there any difference between these two?
Actually, seizure is a blanket term. Let's say fever. Fever can be due to any reasons, right? Like that, a seizure can occur due to any number of seizure reasons. Okay, it is usually resulting from an abnormal electrical activity in the brain. Okay, and normally 2% of the general population can have one episode of seizure without any reason to. So generally speaking, seizure means it's not a disease, whereas epilepsy means it is the predisposition of a person to develop multiple seizures. That means they are prone to get these multiple abnormal electrical discharges in the brain which result in some sort of symptoms. Okay, the most common one is the one we see in the movies, in which the person suddenly becomes blank and jerks the limbs and falls down. So this is epilepsy. So this is the difference.
Okay, so epilepsy is basically a brain disorder and
epilepsy
it's neurological.
is a disease, it's a neurological disease, and in which the person can get any number of seizures.
Okay. So could you please elaborate on what exactly epilepsy is for the benefit of our viewers in medical terms, what exactly it is?
Like said, epilepsy is an abnormal electrical discharge which causes multiple seizures in a person. So this can be due to one, a trauma to the brain, especially during childbirth, or a blunt injury, blunt force injury in which a person falls to the ground
down,
and or sometimes if there is a bleeding into the brain. Another thing is that electrolyte abnormalities in the brain, like the sodium, potassium or calcium in our body, for some reason they are getting depleted in our body. This can result in an abnormal electrical variance in the brain, and this can result in seizures. Another reason is that a tumor growing, a mass lesion growing in the brain. This can compress the normal brain and this can result in seizures. Or if the person or the child is having some sort of syndrome, that means a genetic abnormality, it can impart certain changes in the development of the brain, which again result in an electrical abnormality resulting in seizures. So what happens is that there is a hypersynchronous discharge of electrical discharges in the brain. So what happens is the brain shuts off for that moment, and this hypersynchronous discharges takes over the entire function. So this is when the persons become unconscious or there will be loss of awareness, and depending upon from which part of the brain this electrical discharges are coming, he can have behavioral changes, abnormal limb movements, abnormal eye movements, okay, and then these discharges are automatically controlled by the brain itself. At that point the seizure abates and the person will be continuing in a coma-like state for a couple of minutes, then he wakes up.
So what are the symptoms to look out for? How do you know when a person is getting a seizure? What are the symptoms that we should have in mind? Maybe this could be a seizure and he or she requires immediate medical attention.
That's a very good question, because the thing is that most of us think that seizure means it's just the sort of thing that we see in
the movies, yeah, with shivering.
It's actually not that. Sometimes certain types of seizures called absent seizures, in which the person can have just blank stares only. This usually happens in children. So usually what happens is that their teachers report that he is absent in school, or he is not attentive in classes, the notebooks may
That
be
focus and concentration will not be there.
not be there. The notebooks may be incomplete. Okay, the peer group, his friends may be saying that
Is not
sometimes
involved
he is,
in
he is-
the
he is out of this
activities.
world. Such episodes can be a sign of a seizure called absence epilepsy. This usually happens between the age of 7 to 12 years of age. This is called childhood absence epilepsy. Another thing is that there are certain other types of seizures which are called complex partial seizures, in which the seizure may have two parts. Once the patient can get a sensory perception, like he or she may see a visual thing or an abnormal abdominal perception of pain or something coming up, or they may hear some buzzing sound, and this is usually followed by behavioral arrest. That means whatever they are doing, they will suddenly stop.
So this could be a hallucination, you mean?
It can be a hallucination sort of thing.
Okay.
And then again they goes into certain bizarre behaviors that occurs only during the seizures. There are even seizures in which the person just laughs. This is called gelastic seizures. This happens in a specific sort of condition called hypothalamic hamartomas. And also there are seizures which are only situational. So you might have heard that certain persons, when they at the sight of blood they may faint. This could very well be an epilepsy. There are seizures in which when you bathe, this produces a seizure. It's called bathing epilepsy. So there are different myriad
many
types
different
of,
kinds of epilepsy. But does stress contribute to this? Like you spoke about blood just now. So
certain types of seizures can be precipitated by stress. It can be a body stress, it can be a mental stress. Okay, the thing is that any sort of situation in which the brain is overworked, this usually result in seizures. That is the thing.
So which age group is more prone to this? Because you spoke about children, that's quite common, I guess, between the age of 7 and 12. And is it the elderly who are more prone to this? Is there any particular age group
Actually,
for this one?
seizure doesn't have an age bar.
Okay.
So from birth to death, at any time, any person can get
It can
seizure.
happen to anyone.
But again, like you said, it's more in children and in the elderly. Okay.
Elderly is above 60 or?
Above 60
above
years
60,
usually.
okay.
And also maybe you can say below 10 years of age, it's seen more. Why? Because in the children the brain is developing. So any abnormalities in a developing brain can cause these sort of abnormal electrical changes. And also in the elderly, the brain is getting degenerated. So again they are prone to or susceptible to any minor changes in the electrolyte, or sometimes they may be having diabetes. So high blood sugar as well as low blood sugar can result in. Also head traumas are more common in adults. I mean elderly, they are prone to fall risks, right? So
Even kids for
yes.
that matter, yes. Okay. So what are the most common causes of epilepsy?
In the Indian scenario, studies show that the most common cause of epilepsy is head traumas, head injuries. So a head injury resulting in a brain scar, this act as a nidus for this abnormal electrical discharges. So this is the most commonest cause. And also birth injuries during childbirth, because as we know we are a developing nation. So childbirth sometimes, especially in the northern part of our states, may be home deliveries which can result in reduced oxygen supply to the brain during childbirth, or some trauma which goes undetected, and later when they develop into adults, this can come out as epilepsies. Other things are genetic syndromes, low blood sugar, changes in the electrolytes in the body. These are the common things that result in seizures and epilepsy.
So head trauma is the main reason
In Indian scenario.
in Indian scenario. What are the tests that you normally advise to evaluate epilepsy? Normal tests which are done.
When a patient comes with a history of epilepsy or history of seizures, the most important thing is the history. So ideally it is said that a person who has seen the episode should accompany the patient. Then only we can clearly identify whether
What
this
kind
is,
of
this could be
seizure it is.
loss of consciousness due to low BP. This could be something due to low blood sugar. But seizure has got certain specificities with which we can identify. Sometimes even due to certain mental health disorders, they can like this is called non-epileptiform paroxysms. It should not be said like that, but sort of a fake seizure.
Okay.
It's not fake.
Not fake for the person who's experiencing it. Yeah,
it may be true, but we can say for general purpose it's fake. So the history, how this occurred, is very important. So we always ask for a witness. Okay. And another thing is that we have to rule out this electrolyte abnormalities, especially low blood glucose levels. Especially in the elderly, they may be on oral hypoglycemic agents for control of type 2 diabetes, and they have forgotten to take a meal. This can very well result in seizures, and in that case, if this is due to low blood sugar, he or she may not need prolonged treatment. So the electrolyte evaluation, that is the blood workup. In few cases, infection can be a cause. Okay, infection in the sense fever can precipitate a certain type of seizure in children below 5 years of age. This is called febrile seizure.
We have seen, a lot of kids when they have very high fever, they become delirious, so they start shivering. So this is part of
this could be
seizure?
A febrile seizure.
Okay.
Okay. This febrile seizure is not an epilepsy. That means this is not per se a disease, but this is a disadvantage of the developing brain actually. So the developing brain cannot cope up with the high temperature of the fever. So that result in an abnormal electrical discharges. Usually these febrile seizures, they automatically disappears once the child crosses the 6 or 7 year mark. That means his or her brain is able to handle the stress of the fever. Okay. In the elderly sometimes, or in the young adult or adolescent, fever with a seizure may be an indication of a brain infection. It could be something called meningitis or meningoencephalitis. So this is a dangerous situation. This is a sort of a medical emergency which needs immediate intervention and management.
Doctor, you also mentioned about genetic syndrome a few minutes earlier. So does that mean that this is hereditary to a certain extent?
Some of the seizures are hereditary, that means familial. It runs in the family. So a family history is always important in asking whether somebody in the family is having, especially these sort of seizures start from a very young age. So history of taking treatment, history of loss of consciousness and fall attacks in the family, this is very important. Okay. Another investigations we always do is a neuroimaging, a scan of the brain. Why? We need to detect whether there is a tumor, any sequelae of trauma, any scars or anything, any bleeding into the brain. These sort of things can be detected by a scan. Usually for ease of purpose, sometimes a CT may be okay, but almost always we choose an MRI. There is even a protocol in MRI for epilepsy. It's called epilepsy protocol. Ideally, when a person comes with a history of multiple seizures, he or she should undergo an MRI. And the most important test of all is something called electroencephalography, in which we attach multiple electrodes on the brain of the patient, not on the brain exactly, on the scalp actually, and the machine measures the electrical activity of the brain, and we do certain stress tests, and these stress tests are supposed to increase the electrical aberrancies in the brain, and we measure it for a fixed period of time, and this is reported, and this has got almost a 40% peak rate. So we can almost clearly identify if they come immediately after a seizure, and EEG is done immediately after a seizure.
So doctor, let's say head trauma occurs, a patient, a child or an elderly person falls down and immediately we don't see any seizure happening. Is that person still at a risk of getting this maybe in the next 1 or 2 weeks, or what is a time span where you should be very careful?
I mean, when a head trauma occurs, if there are few things associated with the head injury, we should be very careful. Like after the head injury, if the patient is confused for some time, or if there is a memory problem for some time, or if there is recurrent repeated headaches or dizziness after the headache, this means that there is an injury to the brain.
And
Okay.
vomiting also, I think
Vomiting
in case of
also,
small
yeah.
kids, we say that
Vomiting,
we
yeah.
have to see whether
So
they're vomiting.
if that is there, this means that there has an injury, an injury has been there. So this is an indicator that there is a rare chance that he or she can develop seizures later. Actually, there are two types of epilepsies or seizures that occur after head injury: the acute post-traumatic seizures and the later ones, the chronic post-traumatic seizures. The acute ones, if they occur, this is due to the immediate injury, okay, and they are usually controlled with medications, and the patient does not have a risk of developing epilepsy further. But
That'll be a one-time incident, immediately
incident,
after the fall.
after.
Okay.
But the chronic ones, after an injury, if the patient, let's say after 3 months develop a seizures and we take an MRI and it shows an injury to the front of the brain or side of the brain, this means that he or she may have to be on medication for the rest of their life. Why? Because that injury is there, it's not going to go away.
So what are the treatment options available for this?
The most important treatment option available are oral medications. Then there are advanced treatment modalities like epilepsy surgeries, vagal nerve stimulation, and implantable devices. These are done at very advanced centers with uncontrollable epilepsy. Uncontrollable epilepsy means those epilepsies which are not controlled with adequate pharmacological therapy, that means adequate oral medication. So oral medications are the most important treatment for any sort of epilepsy. In some cases, when a patient presents with an immediate seizure, or we as doctors visualize a seizure in emergency or in our OP department, we may use injectable medications. Okay. There are n number of anti-epileptic medications. So one anti-epileptic medication may be suited for one type of seizures, another may be for another type of seizures. For example, there is a medicine called sodium valproate. This is a preferred treatment for primary generalized epilepsy syndromes, and this may not be as effective as another medicine called carbamazepine, which is most commonly used in complex partial seizures. Okay. So it is for the neurologist to decide which medicine to start and how long to continue. The usual period of treatment is 4 years. If the patient, after adequate medication, continues 4 years without any seizures, then only we can slowly taper and stop the medication. And also another thing is that few of us may be afraid to give this anti-epilepsy medication to children. Many of the parents come and ask
Because
whether
they're worried about the side effects of the medication.
Yes. So the most important thing we should understand is that there is always a fall risk associated with seizures. Especially in children, this is dangerous. They are going to school. That means in an unmonitored environment, this fall risk can cause even death.
It can be fatal.
Let's say the child is standing near a water body and he or she falls into the water body, and if he or she is in her or his normal sense, they will try to escape from this. Somebody will see. But if the fall is with a seizure, the child will not respond. They will go directly for drowning.
Dangerous, yes.
An adult or an adult female cooking in the kitchen, he or she developing this transient loss of consciousness and falling into a gas stove. What can happen? Because I have seen such cases. Or somebody who is having a risk job, that means they are doing their work at a height. Falling down can take their life. So in order to avoid such situations, sometimes we may have to take medications with some side effects. But then again, these side effects are not serious. Like older anti-epileptic drugs had severe significant side effects. The newer ones are with less side effects, and they are easily monitorable and they can be easily managed.
Okay, and it's not lifelong, right? You can always, after a few years, like you mentioned earlier, it can be tapered and you can come
I can
off it.
say in percentage wise.
Okay.
Okay. If there is no seizures, 70% of the cases we can stop the medication after 4 years of adequate treatment. But in 30% there will be recurrence. Of that 30%, 50% may have to continue medication for the rest of their life.
But I think when you weigh the pros and cons, I think it's better to
Better
go
to
for the
be on
medication rather than
Exactly.
putting your life in danger. So, having to witness somebody going through a seizure or an epileptic attack can be quite unnerving, you know. So, I think we should know what are the do's and don'ts. Let's say we witness this at home or, you know, in the playground or anywhere. So, what should we keep in mind when dealing with
Exactly.
a seizure patient?
So, visualizing a seizure is like seeing someone die, to be exact, because
can send us into panic mode, you know.
So, what you should know is that he or she is going to fall down. So, prevent the fall. He or she should not fall down and hit the head and cause an additional head injury. So, let them lay down wherever they are standing. It should be on the road, it should be on the pavement, anywhere. Okay. Loosen all the tight dresses. Do not put anything into their mouth, even your hand, because when a person is having seizures, they will be violently clenching their mouth. If you put something, it can break and it can go into the windpipe and can choke them. If you are putting your finger, they can even bite away your fingers. I have seen such cases. They will not know what they are doing and they will be violently clenching their mouth. Another thing is that turn them to one side, left or right side, preferably towards the left. Why? Because when a seizure is going on, there is a good chance that there can be frothing from the mouth, there can be vomiting. So, when a person is having this frothing or having vomiting, they are unconscious. If they are lying supine, there is a good chance
they will choke on their own vomit or
so turning them to one side will assure that this goes to the outside. Okay, and immediately call the national emergency number and take them to a hospital, because we don't know what is the reason for the seizure. He may be an epileptic on medication and forgot to take the morning medicine. This could be a brain bleed also. We don't know the reason for the seizure. Another thing is that always try to see what are the things happening to that patient, so that you can explain it to the doctor when you are visiting.
So they can, it will be easier for them to pinpoint the cause.
Ideally, all epilepsy patients should carry something called epilepsy emergency contact card. So this is an international norm. They should say that they are epileptic. It should have the medications they are taking and an emergency contact number, like if they are found unconscious.
So doctor, before we wrap up, would you like to explain to us in a nutshell the points that we discussed today and some takeaway message for our viewers? Can this be prevented and what are the measures to be taken?
Yes, especially in a developing world like us, it can be prevented. The most important thing is wearing a helmet. The most important cause of head injury in our part of the world is head trauma, which is road traffic accident. So wearing a helmet can prevent an epilepsy. Then hospital deliveries, especially in southern part of Kerala, there is a good number, I mean 100% of I believe the deliveries are happening in the hospitals, and this sort of prevented lot of epilepsies. Always get yourself evaluated if you have this sort of abnormal falls, loss of consciousness, loss of awareness. This could be an epilepsy, and fear is not the option. Most of the patient, why they do not go for this evaluation or treatment is that there is a taboo associated in the society with epilepsy, that patients with epilepsy, they cannot do normal things, especially females. I have seen females who getting married, after marriage they stop the medication and then they start falling in the in-laws house, and this is creating problem. They can take medication, under follow-up they can get pregnant, they can have children, they can have a very normal life. Even the new laws in India, this says that epilepsy is not a cause of divorce. Okay, that's very important to know. So this is very important. Fear is not the option. Go see a doctor, get yourself treated.
Thank you so much, doctor, for taking the time out to come and be with us today and for explaining to us in detail about epilepsy. Thank you so much. Appreciate your time. Friends, I hope all of you found this episode very useful and informative. As doctor rightly mentioned, fear is not an option. Epilepsy is not something to be scared of. It can be cured. It can be controlled with proper medication. So do seek medical care as and when required, and please follow the guidelines prescribed by the doctor whenever you see a patient having an epileptic attack. Wishing you all good health and happiness always. This is Anupama signing off. We'll meet again next Tuesday at 8 p.m. with a different topic. Good night and stay safe.